Good morning, everyone. I know it's a little earlier than yesterday, but we can go ahead and take our seats. We've got a very packed agenda today, and we want to go ahead and get started. So for everyone who was here yesterday, welcome back to day two. If you've just joined us, welcome. We had some really incredible scientific content and discussions yesterday. There will be some recordings and proceedings available on the website if you missed those. But just really pleased to have the opportunity to continue our journey through the Accelerating Medicines Partnership Program. Yesterday, we had a really enlightening look into how the program launched. We had some really awesome scientific presentations from the first several AMP programs and started to see how the impacts of that science are really beginning to bring benefits to the patient and the research communities. So today, we do have a few more AMP programs to continue to look into in depth. But what I'm really excited about today, and really for this entire symposium, was the opportunity not just to look at individual programs, but to really bring together cross-cutting conversations. And so later this morning, we have heard some allusions to the Systems Biology of Inflammation Initiative, but we will have an entire panel dedicated to the discussion of the challenges and the opportunities in creating interoperability in the AMP data sets and how that's going to drastically increase the value of those data sets for research and for clinical benefit. We have a panel right before lunch with our phenomenal FNIH patient ambassadors, many of whom are affiliated with the AMP programs, to talk about how FNIH's commitment to patient centricity in the AMP program, and really in all the work that the foundation does, is our guiding star in all of the work that we do. We also have this afternoon a session with some senior representatives from the FDA on how the various AMP projects can, or in some cases already do, engage with regulators to ensure that the outcomes of the AMP research have the maximum benefit to patients in as short of a time frame as is safely possible. And as we're looking back over the last 10 years of success of the AMP program, know that we're also looking forward to the future as well. You may have seen some of the signage around in the lunchrooms that AMP will be launching 2 new projects later this year, a continuation of our Parkinson's disease efforts with an expansion into other related disorders, as well as a brand new AMP in ALS. We have other projects that are at different stages in the pipeline, and I know that there will be new ideas coming into the review and development process as we continue to move forward. I've been with the foundation for about 2.5 years, and the growth of the AMP program in just that short period of time has been absolutely incredible. And I believe that it won't be very long before the program exceeds $1 billion in resource commitments and has over 100 industry, nonprofit, patient, and government partners joining together to accelerate team science for the benefit of patients, clinicians, and researchers everywhere. So thank you again for joining us for the second day, and I'll turn it over to the heart failure panel to get us started for the morning. Thank you.